Have you ever asked yourself, what exactly is female infertility and why is it a concern for many women globally? It's a question that strikes at the heart of a challenge faced by many women around the world. Female infertility is defined as the inability to conceive after a year of regular, unprotected intercourse. Now, you might be wondering, just how common is this? Well, globally, about 1 in every 4 women of reproductive age grapples with some form of infertility. That's a significant number, and it underscores the importance of understanding this issue. Female infertility is more than just a personal or family matter. It's a global health concern with far-reaching implications for societies and economies. It affects mental health, relationships, and personal identities, and can even lead to societal stigmatization in some cultures. Now that we have an understanding of what female infertility is, let's delve into its causes. So what causes female infertility? There's no one-size-fits-all answer to this question, as the causes are as diverse as the women who experience them. Firstly, let's look at ovulation disorders. Ovulation is the release of an egg from the ovaries, a process that is essential for conception. Disorders that disrupt this process can lead to infertility. Polycystic ovary syndrome, or PCOS, is one of the most common ovulation disorders, affecting as many as 1 in 10 women of childbearing age. It's characterized by irregular periods and high levels of androgens, which are male hormones. Next, we have uterine or cervical abnormalities. These can include polyps, fibroids, or abnormal shape or size of the uterus. These abnormalities can interfere with implantation, the process where a fertilized egg attaches to the uterine lining. Thirdly, damage or blockage to the fallopian tubes can prevent sperm from reaching the egg or block the passage of the fertilized egg into the uterus. This damage can be caused by a number of factors, including pelvic inflammatory disease, a previous ectopic pregnancy, or certain sexually transmitted infections. Lastly, let's not forget about age. Fertility naturally begins to decline in women in their mid-30s, with a more significant drop occurring around the age of 40. This is because the quantity and quality of a woman's eggs decrease as she ages. It's important to note that these causes can occur independently or simultaneously. A woman may have an ovulation disorder and also have fallopian tube damage, or she may have a uterine abnormality and be of advanced reproductive age. Keep in mind that this is not an exhaustive list. There are other factors that can contribute to female infertility, such as endometriosis, early menopause, or certain genetic disorders. In conclusion, the causes of female infertility are complex and varied. They can be biological, age-related, or a combination of both. However, understanding these causes is the first step towards seeking appropriate treatment and support. These are just a few of the causes. Now, how does a woman know if she may be struggling with infertility? What are the signs that a woman may be infertile? This is a question that often lingers in the minds of many women, especially those who have been trying to conceive without success. While the symptoms of female infertility can vary greatly from one woman to another, there are some common signs that could indicate potential fertility issues. One of the most common symptoms is irregular menstrual cycles. If your periods are not coming at regular intervals, it might be a sign that your ovaries are not releasing an egg every month, which is crucial for conception to occur. This could be due to an underlying medical condition or hormonal imbalance. Speaking of hormones, fluctuations in hormone levels can also manifest as symptoms of infertility. These can include changes in skin condition, reduction in sex drive, thinning hair, or even unexplained weight gain. These signs are often subtle and can easily be attributed to other factors, which is why they are often overlooked as potential symptoms of infertility. Then there's the experience of painful periods. Now, a certain degree of discomfort is normal during your menstrual cycle, but if you're experiencing severe or prolonged pain, it could be a sign of endometriosis or other conditions that can impact fertility. In some cases, a woman may not have periods at all. This condition, known as amenorrhea, can be a clear indicator of infertility. It can be caused by various factors such as stress, extreme weight loss, or problems with the pituitary gland. Lastly, and perhaps the most obvious sign, is the inability to conceive after a year of unprotected sex. Infertility is typically diagnosed after a couple has been trying to get pregnant for 1 year without success, or for 6 months if the woman is over the age of 35. It's crucial to remember that having one or more of these symptoms does not guarantee that you are infertile. Many women with these symptoms have been able to conceive, and many without any of these symptoms have faced challenges. If a woman experiences these symptoms, What can she do about it? Well, the first step is always to consult with a healthcare provider. They can help determine the cause of these symptoms and guide you toward the appropriate next steps. How do doctors diagnose female infertility? That's a question many of us grapple with when faced with the challenging journey of infertility. Let's delve into the details. The first step in diagnosing female infertility typically begins with a thorough review of the patient's medical history. Doctors will ask about menstrual cycles, sexual habits, contraceptive history, prior pregnancies if any, and any existing medical conditions. This step is crucial as it provides the doctor with a comprehensive understanding of the patient's health background. Next, a physical examination is conducted, focusing primarily on the pelvic region. This helps to identify any physical abnormalities that might contribute to infertility, such as cysts or fibroids. Blood tests are another vital part of the diagnostic process. These tests can reveal important information about hormone levels, which can directly impact fertility. They can detect any hormonal imbalances which might be causing ovulation issues. In addition to blood tests, imaging tests such as ultrasounds or X-rays are often employed. These tests provide a detailed view of the reproductive organs, making it possible to identify structural problems like blocked fallopian tubes or uterine abnormalities. One of the more invasive but informative tests is laparoscopy. This procedure involves inserting a tiny camera through a small incision near the navel to examine the ovaries, fallopian tubes, and uterus. It's a direct way to find out if there are conditions like endometriosis, scar tissue, or other issues that could be causing infertility. It's important to remember that early diagnosis can lead to more effective treatment. So if you're having trouble conceiving and it's causing you stress, reach out to a healthcare professional. They can guide you through these diagnostic steps and help you understand your options. Understanding the cause of infertility can be a significant step toward finding a solution. It's a journey, and it can be a challenging one. But with the right help and support, it's a journey you don't have to take alone. Once diagnosed, what are the treatment options available? Stay tuned as we explore this in the next scene. What are the possible treatments for female infertility? This is a question that many women and couples grapple with when facing challenges in conceiving. Let's delve into the various treatment options available. The first line of treatment usually involves fertility drugs. These drugs work by causing the release of hormones that either trigger or regulate ovulation, the release of an egg. Commonly used fertility drugs include clomiphene citrate, gonadotropins, and metformin. The next step could be intrauterine insemination, or IUI. This is a procedure where sperm is placed directly into a woman's uterus while she is ovulating. This approach increases the number of sperm that reach the fallopian tubes and subsequently the chance of fertilization. Another option is assisted reproductive technology, or ART. This is a group of procedures used to assist in the achievement of pregnancy. The most common type is in vitro fertilization, often referred to as IVF, where mature eggs are retrieved from the woman, fertilized by the sperm in a lab and then transferred back into the uterus. Surgery is another route that some may need to consider. There are various surgical procedures that can address issues such as endometriosis, uterine fibroids, or any structural abnormalities of the reproductive system. It's important to remember that the treatment plan will depend on several factors. These may include the cause of infertility, the woman's age, how long she has been infertile, the health of her partner, and personal preferences. Some women or couples might opt for more than one treatment, or choose to use them in conjunction with each other. There's also the option of using donor eggs or sperm, or even surrogacy. And for some, adoption may become a fulfilling choice. The journey through infertility can be complex and emotionally challenging, but understanding the treatment options can provide a roadmap, empowering women and couples to make informed decisions about their health. Remember, every journey is unique, and what works for one might not work for another. Understanding the treatment options can help women make informed decisions about their health. So, why is understanding female infertility important? We've spent valuable time today exploring this complex issue from various angles. We've defined female infertility as the inability to conceive after a year of regular unprotected intercourse. We've discussed its causes, which range from ovulation disorders to structural issues and age-related factors, and highlighted the symptoms that might hint at an underlying problem. We also dove into the methods of diagnosing female infertility, stressing the importance of medical consultation and various tests. And we touched on the diverse treatment options available, from medication to assisted reproductive technology. This understanding is crucial because it fosters awareness, reduces stigma, and encourages early diagnosis. It's about empowering women with knowledge, giving them the tools to take control of their reproductive health. Remember, infertility is not a taboo, it's a medical condition, and there is help available. With knowledge and awareness, we can better understand and address female infertility, empowering women globally.